Every day, clinicians make decisions that depend on a complete blood count. Yet obtaining those results often means sending samples away and waiting. Increasingly, and across very different healthcare settings, one simple shift towards point of care is changing how clinical decisions are made. At Oxford University Hospitals, one of the United Kingdom's leading NHS teaching hospital networks, clinicians needed access to laboratory-quality CBC results while patients were still in front of them.
So why the HemoScreen? Results within 5 minutes. I mean, that's very hard to find any device with that kind of accuracy and precision to give us those kinds of results where we can actually act on patients and treat them and diagnose them, etc.
What began as a focused deployment quickly proved its value. As confidence grew, so did demand, expanding into new departments and new clinical studies.
It has greatly improved the patient flow in all of the wards that the device has been placed in. Staff are coming back and reporting that since they've been implemented, one, they are very easy to use. Two, the results, the fact we're only waiting 5 minutes rather than putting them in a pod or arranging for porters. It's so much easier for them to have more patient-focused care.
Hundreds of miles away, clinicians across regional South Australia face a different challenge. Here, distance from central laboratories can directly affect how quickly patients receive the care they need.
We have received positive feedback from every site that has received the HemoScreen. They say it's very easy to use, much better than the old device that they were using, and that it has changed the level of care that they're able to provide their patients with being able to get the full blood examination without having to send off blood samples for formal results from a core laboratory. So they can just keep that sort of thing in-house and do faster screening, which ultimately is better for the patients. So overall, it's been very positive, and the HemoScreen has been a significant improvement in the services that we're able to provide.
Access to care isn't defined only by distance. At one of the United Kingdom's largest specialist mental health trusts, the challenge was making essential blood monitoring simpler, faster, and more acceptable for patients.
We had one device and we rolled that out as a pilot. And during that pilot, we collected some patient feedback, so over about 6 months. And from that feedback and from staff feedback and just using that one device alone, we could see the huge benefit that it had.
What began as a pilot quickly demonstrated benefits across the service, changing workflows for clinicians and improving access for patients.
We are quite lucky to have 20 devices in our trust now, so we have got those spread out across the trust. So we have got them dotted around so that all patients can access them. It has improved our service efficiency. So having this device it's, as I say, it's a lot simpler, it's a lot quicker, it streamlines our workflow massively, reduces any follow-up admin, and the device is portable.
Every healthcare setting is different. Every patient is different. But the moments that matter have one thing in common. They depend on having the right information at the right time. Better information where decisions are made.